in as resources, if they are viewed with that at the back of our mind, we're likely to put programs in place that will make them to be reused, and that will bring much more better issues. As sustainable sanitation, there's no fit for all thing to do to say, okay, if you do this, you do that, you get a sanitation that will be sustainable. It's approaches that tries many things. But at the end of the day, you'll be seeing that consideration must be given to climate change. You must be given to water availability. You must consider what is the agricultural practices, either in that area or in that zone that you're planning for. You must look at the socio-cultural preferences, ability, safety, and some technical preferences among them. There are so many. I just selected a few for a discussion. Next slide, please. This slide that you're seeing is like a presentation of what a sustainable sanitation would look like. If water is used and there's no recovery of that water, what this picture is showing is that there will be waterborne diseases or sanitation-related diseases. There will also be depletion in the groundwater that is available because you are not recovering the water that is being used. So you are extracting the groundwater always. There will be water pollution because the water used will be charged or be directed into water bodies, and there will be pollution. And also, if nutrients are used and it comes back in the form of feces or in the form of feces, if they're not reused or they are not recovered, it goes back into the water as a waste, and it causes pollution, and it also causes low yield because you could have used the products, of the feces as manure on the ground. So if that is not happening, you are likely going to have very low yield. You are likely going to have water pollution because all the excreta will go back into the water, and then you are likely to have people on sick bed because they have water or sanitation related diseases. So for us to do sustainable sanitation, we need to look at some criteria. If you are going to, please, next slide. If you are going to a plan for a sustainable sanitation, any approach that you want to plan, you must look at some criteria. And one of the basic criteria is the health and hygiene. Next slide, please. Is the health and hygiene. So we say sanitation system must put an effective barrier between its user and the environment, and must prevent exposure that could affect public health at all points of the sanitation system. Please, next slide. Okay, sanitation system. Then next is environment and natural resources. The environment must be protected if you're planning any sustainable sanitation. You must also think of the use of little energy, little water, or other resources when you're planning for a sustainable sanitation. The other criteria is technology and operation. A sustainable sanitation must utilize a technology and a mode of operation that are well adapted to the local circumstances. We've had projects in the past taken to communities, and they're not able to manage it because the technology is way much ahead of their understanding, and therefore those are abandoned or they are being disused like that. And the next criteria is financial and economic issue. The cost of sanitation system must relate to the financial capability of the household. So if you are telling a household that we must use a particular kind of sanitation facility, are they going to be capable of either maintaining it or operating it at the long run? So that must be taken into consideration. We must also try as much as possible that any costs arising from operation and maintenance are easily being able to be managed by the household. Another part of the criteria that we would look at is the sociocultural and institutional aspects of our sustainable sanitation. A sanitation system only lasts and can be sustainable if it is appropriate and accepted by the community. The moment it is not accepted because maybe it's not culturally accepted, people are likely to abandon it at the end of the way. And that acceptability must include the whole sanitation, not just about toilets, but about the maintenance, about operation, about the recharge and the reuse of the whole system. So we're not talking only about the toilets that is being built, but the whole system about it. A sustainable sanitation must also be socially acceptable, convenient. It must respect gender issues and impact on human dignity. It must also consider impacts on food security. If we have a sanitation system that we may not be able to use the product on food production, we're saying it's likely to affect the food security. And then in regards to institutional aspect, it must be in compliance with the legal framework and must be a stable and efficient institution within it must be operated within a stable and efficient institutional setting. We're doing a sanitation in a community, there must be a setup that is able to manage it. What is the setting? Who is going to say, do this and don't do this? Who is going to manage it? All those must be given into consideration. Next slide, please. We would like to take a look at the facts, even though those have been mentioned by the Honorable Minister and as some people that made a presentation. Next slide, please. 2 slides. Next slide, please. Next. Look at this presentation up there, where we want to be. The access percentage of the population using safely managed sanitation in Nigeria, 19.2% nationally, and then 24% urban, and then 17.2% rural. This was just published. So this is for safely managed. And you know that based on this, we're really far from where we want to be. Next slide, please. If you look at the geopolitical zones, it's not different from what we just saw. The Southeast seems to be leading in terms of states that are using safely managed more than states. Even with that, we're still really where we ought to be. And if you look at the next slide, if you look at the states, you will see the diversity. Only a few states, over 30%, those that are using safely managed sanitation facilities. If we go to those that are using basic sanitation facility, next slide, you will see that, yes, we have a good, fairly average in terms of what is being presented, but then with that, we're still far from where we want to be. If by 2025, like the Honorable Minister said, and like it has been stated here severally, that Nigeria must attain ODF, I don't know which kind of speed we will need to do to be able to meet that by 2025. Next slide, please, is the percentages of people that are still defecating in the open. Like the minister said in his speech earlier, over 40 million Nigerians defecating in the open. And this is not good at all. So with all this at the back, standing and looking us straight in the faces, we also now have the issue of climate change. We already have bad situation in terms of access. Now we have the issue of climate change. And the evidences of climate change are all over. This year, 2020, there was flooding in some of the states, in many states in Nigeria. 2012, big flooding almost across the whole country. And that does not help in terms of facility maintenance or facility access and so on. Because a whole house will go down due to flooding. You can't stop the toilet of the house to say, oh, no, the houses are down. They are being flooded, but toilets are standing. It doesn't make sense. It doesn't go right. So we know that the evidences of climate change are all there. We have, increasing intensity of rainfall, which have over the years caused flooding. And if there is decrease in rainfall, it also causes a drought. And drought also has negative impact on sanitation facilities. So the impacts of climate change, which we cannot wish away. I wish you can say climate change should just disappear. But even if it disappears today, the impacts will still be with us for a very long time. Some of the impacts are flooding. And we know, like I said earlier, what flooding can do. It can burst the sewers. It can overflow the toilets. It can make the toilets that are basic to be really overflooded, and at the end of the day, every of the feces gets back to our water and it contaminates the water. We also have the issue of drought, especially in the northern parts of this country. And we say if there is drought, there is likelihood that there will be shortage of water. And so facilities that require plenty water to be used may not have that easily, and because of that, we'll have issue with waterborne, sanitation-related diseases. Also, drought can cause people not to properly wash their hands because of lack of water in the community. So with what we have as our figures that are not very good for us, and with the issue of the climate change, what do we do? So we're suggesting that we should plan for sustainable sanitation. Next slide, please. Planning for sustainable sanitation. And we say whatever planning we're going to do must have these 4 issues that are listed there as their key focus. Our planning must have human dignity. Whatever plans we're going to put in place must have human dignity, must talk about the quality of life and the environmental security at both household level and other levels. Our plan must be in line with good governance. What are we doing in terms of what we spend on sanitation? Also, we should consider in our plan that waste should be considered waste. And if we do that, we'll be able to integrate our planning into appropriate water resources management. I will also say when we're planning, let the domain of our plan be such that it can be handled within a small, minimum practicable size. For example, when you plan, you talk about the household. The households are it's easier for household members, or we talk about the community, or at ward level, or at LGA level, and so on. Not gigantic plans from the federal and trying to say, okay, we'll cascade it to the LGAs. We should have plans that will take care of these practicable sizes that we have listed. And our part of our plans now should be how do we build resilience, because we already agreed that climate change is here with us. We say for us to build a resilience towards the effects of climate change, we must have facilities, we must work towards establishing high quality services that will last. You and I know that some of the facilities, even in places that are declared ODF, may have issue with being sustainable. So we must have facilities that will last. We must try as much as possible to engage with experts for them to share their expertise, with the government and the private sector on innovations and technology designs that will be able to withstand the effects of climate change in the long run. In our planning also, in our building resilience, government at all levels are encouraged to ensure that water and sanitation are at the heart of climate change adaptation and development plans. So when climate change issues are there, water and sanitation should be a core thing, because the effect of climate change is devastating on those facilities, and that also has a big issue on the general population. CSOs to engage the government through campaigns and drives, for them either tenfold or more. We have been doing, but it seems we need to do much more, especially with the 2025 in focus, even 2030 in focus. The CSO must engage the government more for them to give a tenfold or more attention to climate financing for water and sanitation. So I tried to list up some adaptation strategies. There are a lot of lists there in the next slide, and say first and foremost, whatever strategy we're putting in place must ensure the rights of the people to water and to sanitation. It must also prioritize access to water for essential domains and for sanitation purposes. Resilience for both water and sanitation infrastructure as a major climate adaptation measures, and so many other strategies that are listed there. Part of them also, we say we should ensure that accountability and compliance established for states' decision-making on adaptation and mitigation. I was hoping that those that attended the first part of the program that came from the states will be seated in this, so that they will know, they will hear, know, and probably take action. We say we should try as much as possible structure to be able to meet with future challenges and cope with the risk associated with climate change in all areas. So we try to, next slide please. We say we're creating sustainable sanitation through stakeholder participation. I'm just going to talk about the government as a stakeholders. Other stakeholders will be part of the discussion by the discussers. And I said for the sanitation basically are going to be two roles. Probably we'll get more, but two roles. One, assessment, and the other one will be strengthening climate change resilience in national level mechanism for and that a lot of things are listed under there. For example, under strengthening resilience in national level mechanism for sanitation, we talked about, or I talked about mainstreaming climate change into sanitation policies and governance. We also talked about support, there should be a support to improve cross-sectoral coordination and collaboration, and they should also address the issue of national health workforce engagement and capacity. Sometimes you go to some LGs and they'll tell you we don't have enough staff, or they have the capacity in terms of training and so on. So we're saying if there will be, they should address the workforce and then build their capacity. We also talked about strengthening climate and sanitation and health information system. This should be part of what the government should try to do when it's planning its a sustainable sanitation policy or project. Then we talked about developing coherent national approach to sanitation infrastructure, technology, and service delivery choices. And finally talked about to mobilize national financing mechanism for tackling the effect of climate change on sanitation infrastructure. If we go to some states that were flooded this year, we will know that even after the NTGS has declared them ODF, they may have issues of having their facilities flooded. So there must be a financing that's okay, this has happened, how do we bring them back on board? The other stakeholders that I know my colleagues are really going to talk about the women, the private sector, the youths, the media partners, among others. Thank you very much for listening.
I think she deserves a round of applause again. Please, let's give it to her. Thank you for that presentation, and you have set the ball rolling to discuss the issue on the sanitation. Someone said on our platform of Nigerian professionals in WASH, they say a toilet is not just a toilet, it's a lifesaver, dignity protector, and opportunity maker. And that means inside the toilet there are lots of things that can happen, making opportunity and giving us dignity. So, to set the work, we would like to start calling the, okay. We'd like to commence the panel discussion, and I would like to call the panelists for this particular section. And I will start with the chairman for this panel that will be leading us and be directing the affair of the panelists. Please join me to this podium. When I bring to the podium is the National Consultant on National Action Plan for Revitalization of Work Sector in Nigeria. Please join me, welcome Mr. Timehin Uweja. Please let's give him a round of applause. Thank you very much, sir. Take this about the seat there. And then I'll call, looking at the area of socio-economic impact of sustainable sanitation. You know what that means, job creation, health benefits, and other productivity sector that WASH can be involved. So talking on that will be the national coordinator of the new Sanitation and Hygiene Fund, Miss Elizabeth Jayo. Please let's give her a round of applause. Thank you. All right, keep clapping for her as she comes to the podium. Thank you so much. And also on the podium with us is the program manager of the United Purpose. United Purpose has been a great supporter of WASH in Nigeria. Please, Mr. Nampet. I call him the chairman. Please let's clap for him very well. Mr. Nampet will be looking at the creating sustainable sanitation through stakeholders collaboration. That means inter-ministerial collaboration, roles of private sectors and CSOs, and roles of development partners and others as we move on. And also, joining on the panel as well is the head of advocacy, policy, and communication of WaterAid, Mr. Kolawole Banwo. Please let's clap for him. And he will be leading us on social and resource mobilization for sustainable sanitation. I'll be leaving the rest of this discussion to the chairman of the panel. Then after that, I'll come back. Please, let's give them a round of applause as they commence.
Thank you very much, Mr. Moderator. The Director of Water Quality and Sanitation, Federal Ministry of Water Resources. Can we please ask the speaker to please join us? They said another cut person here for Mbako. Please give her another round of applause. She gave us a very wonderful presentation, and she set the stage for this conversation that we are about to have. Welcome, ma'am. So we've listened to her, and I think that, like I said, it's a very good presentation. Our purpose here is not to look at the woes and count the challenges like we normally will do sometimes in Nigeria. Our purpose here will be to probably provide solutions and strategies and steps that can take us out of the conundrum that we find ourselves, and to help us as a nation to look at sustainable ways of delivering sanitation services in consideration of climate change, like she has advised us. So we'll be reviewing some of the things she said, and we'll be asking our panelists to give us some guidance in coming to that resolution. And then, of course, we'll take a few comments and questions from the audience so that we can wrap up and come out with something meaningful. I've been told that the panel discussion should not take more than 30 minutes. We'll try as much as possible to keep to time. I'm listening to Dr. Dosa. I heard that define sustainability and as it relates to sustainable sanitation, and she was very clear on that. It's that whatever we do today should not impair what others will do tomorrow, so that our activities today do not cause harm. But in the worst case, keep the status quo of what we find going forward. But I think we should go a step further. Our activities today should help to improve the environment that we meet. She defined the two common major problems around sanitation, which is wastewater and fecal sludge. And fecal sludge usually comes from pit latrines and on-site sanitation facilities, while wastewater largely comes from our water closets or sewage systems that we may have in the country. I think that she also did say that